So the first thing that I always do when somebody comes in to see me for the first time is I want to make sure that even though they may have a history of a tick bite, they may have a very positive Lyme disease test. I still want to make sure it's actually Lyme giving them all of their symptoms. And one of the first culprits that I like to look at to make sure it's not, and that is mold toxicity. And that is when people there's about 25% of people that have a genetic predisposition that when you breathe in mold toxins from your world, they're going to get trapped in your bloodstream. And those mold toxins can set up an inflammatory process that looks just like tick-borne illnesses. And knowing that, there's been a number of times that I've just taken a very careful history for my patients. Person came in with positive test and had all the symptoms that look like Lyme. And basically in the history, I just said, so tell me more about what you were doing when you got sick. And he said, I just moved into this house and we discovered about a month later there was a bunch of black mold in the room where they used to keep the aquarium. And so when I went back and heard his story, he didn't get sick until he lived in that house. So to me, it didn't matter he had a positive tick infection test or that he had symptoms that looked like Lyme. I knew that a mold toxicity can look like that too. And so I did order up a urine test to look at the amount of mold toxins in his blood through a company called Real Time. And in his situation, that test came back very positive. We spent, I think, about 6 to 9 months cleaning out those mold toxins, and he became 100% healthy. And I never had to address a positive tick-borne test because either I think his immune system had dealt with it on its own, probably because the immune system can sometimes. So just want to make sure that people are thinking about that. You all know where you've been, and if you've had a black mold growing on your walls, for instance, even if you have a positive tick infection, make sure it's not mold toxicity. If it is, probably treat the mold toxicity first, because often that can be enough to get you back on your way again, too. Okay.